Good evening, Mono County, and welcome to the COVID community conversation for January 21st, 2021. I'll be your host, Brian Wheeler from Mono County Public Health, and I will once again be joined by panelists from the town of Mammoth Lakes and from the county of Mono. So I'm sure we have a lot of topics to cover tonight, so I will first turn the meeting over to Stu so he can give us a little update with his PowerPoint. Stu.
Thank you, Brian. Thank you, community, for joining us. Thanks for all our panelists on this beautiful Thursday, January 21st, 2021. We have a lot to cover, so let's just dive in. Just want to, again, welcome all our Spanish speakers. If you would like to listen to this conversation in Spanish, ask that you click on the interpretation icon right there on the screen when you log in. And we can also watch the meeting live on the Mono County Health Department Facebook event page. So look for that and follow us live. Tonight's conversation. We always include this slide in each of our presentations. You can receive, gather, acquire, get all your latest updates of the Mountain View fire on two portals, one being the Mountain View Fire Incident portal right there on your screen, and from the Mountain View Fire Resources and Recovery Facebook page. So again, two great sources of information regarding the Mountain View fire. Let's get into this latest update here. Again, just want to remind everybody to stay safe, to stay open. We just want to remind everybody, encourage everybody to continue to distance, wash, and cover. Face masks really work. As you can see, if we wore our face masks, we'd reduce transmission by up to 80%. I want to remind and encourage everybody across Mono County to get vaccinated. To do that, we want you to pre-register. We'll have that information this evening in the presentation. And again, encourage everybody to stay informed. There's a lot happening throughout the county. There's a lot happening throughout the state. So please stay informed. Follow us on many of our channels and information. And to be civil and to respect each other. We are literally all in this together. Case stats, these are available on the portal. You can see right there on the top right-hand corner. Just click on that graphic on the portal. You'll get to all this information and more. This is as of when we started coronavirus tracking of our cases back in March of 2020. We're up to 866 cases. And you can see this is the spread of those cases throughout the county. This is the 30-day case rate. As you can see, 866 cases, 30 of those, the 30-day increase is 305 or 54%. And right there at the bottom, we've had 218 cases since January 1st, or approximately 25% of our total coronavirus cases in Mono County has occurred since January 1. 7-day metrics. This is kind of a rolling 7-day metric. You can see here we tested 467 people. 89 were positive, positivity rate of around 19%. And this is kind of consistent with our tracking of our positivity rate over each and every week that we've been following our transmission rate throughout Mono County. You can see our last metric here, which was 110, January 10th through the 16th. Was just a hair over 16%. You can see here the week before was 18, and when we were with you 2 weeks ago, it was 16.2%. So you can see we're definitely fluctuating between 16 and 18%, and certainly decreasing our positivity rate from the highs of 20+% not too long ago. Mammoth Hospital status is still green. Dr. Burrows will be with us this evening and give you an update on Mammoth Hospital. Just a quick update on the regional stay-at-home order. 4-week ICU capacity projections still do not meet the criteria to exit the order. You can see here we still continue to see high transmission rates. We talked about the positivity rate. One metric that they use to track positivity and transmission throughout each county is our case rate. We have a very high case rate. That's second only to San Benito County. And our positivity rate there, you can see, is the 6th and 7th highest in the state as well. The Sacramento area was eligible to exit the stay-at-home order on January 12th. As you get here, some metrics. Talks about the R factor, certainly encouraging decrease, 0.98 across the region, 0.95 in the state. Statewide positivity is 12%. So you can see our 18.4% is certainly higher than the state average. Positive trend, statewide hospitalizations are trending down. That's a good projection. And our confirmed cases and deaths throughout the state are still extraordinarily high. Blueprint for a safer economy. Just a quick slide. I know we haven't touched on this before, but when we are permitted to exit the regional stay-at-home order, we will be assigned a tier based on the Blueprint for a safer economy. And you can see here that our positivity rate and our case rate are well above the purple tier. So if we do exit, or when we do exit the stay-at-home order, will be assigned at this time in the purple tier, but these numbers can certainly change over time. So our goal as a county is to get these down into that red tier status again. And you can see here, there's the numbers right there on the bottom on our small county framework. So we have to be less than 35 cases per 100,000 to get us into, to get us out of that purple tier. Information provided by the state regarding our schools. There's a new website that's been launched called the California Safe Schools for All. You can see the URL is in the top right-hand corner of the slide. Just provides support, information, accountability to first get our schools open and then to provide ongoing safe in-person instructions. You can see here that grades 7 through 12 can only open in the red tier. So that's grades 7 through 12, that's middle and high school. But grades K through 6 can open in the purple tier if the case rate is below 25 cases per 100,000. And as we've just talked about, our case rate is 111. So we are 4 times the case rate at this time. And you can see here, there's some bullets just there specifically talking about Mammoth Unified. But as we know across the county, Eastern Sierra Unified School District did reopen on January 19th. So again, all that information is available on the California Safe Schools for All Plan website. We want to get you to pre-register. When you want to get your free COVID-19 tests throughout Mono County, just hold your phone, hold your camera over the QR code there and complete the online registration. Free testing for all county residents is available on Monday and Thursday at the Mammoth Lakes Foundation. And then we also provide testing on Tuesdays and Fridays with Verily, our partners at Sierra Star Golf Course. And you can see there every Friday in the North County at Antelope Valley Community Center. Here's the schedule. This is the schedule we provide on the county portal. So again, look for that little testing icon. This is updated each week. Do want to remind everybody that there's no daily testing limits for testing every Monday and Thursday at the Mammoth Lakes Foundation. We encourage everybody to come anytime between 11 a.m. and 2 p.m. We don't all need to be there right at 11 o'clock. They have plenty of tests available, so come during your lunchtime, come right at the end. They'll do their very best to fit everybody in. Just a quick vaccine update. I know there's a lot of questions tonight on vaccinations, immunizations. When am I up next? How are we doing? How many doses have we got? When is my time? When is my clinic? So we're going to get to all that information. This information lives on our Vaccinate Mono website. This shows you the number of doses that we've received, how we're doing on our first and second doses, and Brian and his team doing an exceptional job. These numbers change each and every day. They're vaccinating, I believe, each and every day. That Brian will kind of talk about a little bit more. But again, they are free and voluntary, and they are for people who live and work in Mono County, and that's regardless of your immigration status. So we do want to get everybody immunized as soon as we can with the vaccine available that we have throughout Mono County. So where are we now? We are currently in phase 1B, tier 1. So this information is available and it's provided by the state. It does change. So again, right now and today, we are scheduling to vaccinate those folks that qualify in the phase 1B tier 1 category. So that's any individual age 65 and older, and those individuals in the following occupations, such as education and childcare, emergency services, and food and agriculture. So that's anybody that's working on our ranches throughout the county. That's our restaurant workers and so forth. So again, if you're in this category, we want you to pre-register. So we want you to visit us on our portal, complete the Vaccinate Mono questionnaire. This is in English and Spanish. This form changes as per guidance from the state, and this form does not automatically register you for your vaccination. You'll receive a separate email from the state for your vaccination appointment. One thing we did want to bring your attention to, right at the bottom left-hand corner of the slide, I kind of put my mouse over it there right here. So this is not your mailing address. This is your place of residence. So for it says community city, right here, if you're in Swall Meadows, Paradise, you're up in Walker, Lee Vining, June Lake, wherever it is, put in your community that you live. This is important information that we'd like to gather because that helps us plan our vaccinations appointments throughout the county. All right, so I just want to make sure everybody fills that little box out for the place of residence, not your mailing address. We want to know where you live. Just some updates here. If you're unable to complete the questionnaire online, please email us at the COVID-19 help@mono.ca.gov email address. As you said, it does not qualify or automatically register for your vaccination appointment. You'll receive a separate invitation. Vaccinations occur by appointment only. So we encourage you and please ask that you do not arrive at any clinic unless you have an appointment. Our vaccinators have asked that you wear a t-shirt under your many layers so they can kind of expeditiously get at your arm and immunize you with the vaccine. So again, if you can wear a t-shirt under your layers, that will really help our team. You'll get your vaccination card on site. We have received both the Pfizer and the Moderna vaccines, and you will receive your doses dependent upon the availability of those vaccines. We have a comprehensive FAQ on the website. This is growing each and every day. So again, visit us on the Vaccinate Mono website, and you can also peruse the many frequently asked question websites from the CDC, FDA, and CDPH as well. So all the questions that you may have, this is where you can find those answers. Just want to provide a little bit of an update. Everybody's probably seen this in the news. There is a new variant that has been found in other countries and states. Has been seen more frequently in California and has been identified in Mono County. This is the L452R variant. You can see here that they randomly sequenced 59 cases in December, and 16 of those, or 27%, were of this different mutant variant. Still a lot of this is unknown, not necessarily more deadly, but more cases mean, unfortunately, more hospitalizations, potentially more deaths and disability and disruption. And again, they're still determining the effectiveness of the vaccines and monoclonal antibody treatments regarding all these mutant variants. And again, our public health experts this evening on the call will certainly answer any or more questions regarding these variants. Business resources. This website provides all those resources for all our businesses throughout Mono County, so please visit that page. Mammoth Lake's first programs, we have our housing assistance programs. $400,000 is available through Mammoth Lake's housing. And round 5 of the business assistance program closed on January 13th. 45 qualified applications were received, and I know Sandra and the team are working overtime to get through those applications and to get those checks in the mail to each of those qualified businesses. Statewide business assistance programs. We have the Paycheck Protection Program round 2, California Small Business Relief Grant Program. You can see the website available there, and the Mono County Financial Assistance Program, or CUAS. dispersed $420,000 to 48 eligible businesses in unincorporated Mono County. Next bilingual community conversation is Thursday, February 4th. That's again in 2 weeks' time at 5:30. You can join us for our next conversation with this wonderful panel. And again, for all our COVID-19 information and resources throughout all these channels, our website in English and Spanish, there's our COVID-19 help at mono.ca.gov website. And again, want to encourage and remind everybody to subscribe to receive our COVID-19 newsletter issued every Tuesday and Friday directly to your email box. Brian, with that, that concludes the presentation for this evening. Thank you.
All right, thank you, Stu.
Very welcome.
So we have about 45 minutes to answer questions, and I see them stacking up in our Q&A box. So why don't we go ahead and get started?
Can we get a confirmation email that we are in line for the vaccine after we register? I registered last week and have no idea if the registration was accepted or confirmed.
Well, the question I would have is that registration or pre-registration? You should, if you register, in both cases, you should receive an email. When you pre-register, you should receive a confirmation email that you pre-registered. And after you receive the link to actually register for a clinic, then after you click on the link and register, you should also receive a confirmation of your appointment and your appointment time. And again, if you're having issues with that, Stu had that email address up there you can reach out to, and we'll certainly help you out as quickly as we can.
Thank you. If I work in Mono but live in Inyo County, can I still get vaccinated in Mono County?
Yes. Quick answer, I know. Yeah, so if you
Brian, yeah.
Go ahead, Dr.
Yeah, we're both going to say the same thing. Only if your job, is critical infrastructure, essential, and qualifies you for early vaccination. Otherwise,
right.
No. Right.
But if you are some kind of essential service, if you work at the grocery store up here, if you are part of the sheriff's department up here and live in Inyo County, we will vaccinate you.
Do you think this vaccine will be an annual shot like the flu shot because of the various strains?
Turn that one over to the doctors.
Yeah, hi, Tom Boo here. We don't know yet. It's too early to tell. Sorry.
Yeah, I think it still remains to be seen. We're certainly hoping that by vaccinating people effectively and getting enough of the population to have an immune status against this, that it won't be an annual thing. But as Dr. Boo just said, I think it's too early to tell. And I think there is still a possibility, and a distinct possibility, that you may have to get some sort of a booster or a shot every year like you do with the flu shot. And I'm just anticipating what may happen going forward. It may be part of the flu shot in the future as well. And that is reading the tea leaves. That is absolutely not a given. At this point, we are really just striving to get everyone vaccinated and get out of the pandemic scenario, and then worry about what do we do next year as we have more information available.
Thank you, doctors. Let's go ahead and field our next question.
Has the state responded to the letter asking for them to remove Mono, Inyo, Alpine from the Southern California region?
Chief Freevold, can you field that one?
I don't believe we've received a response on that, to the best of my knowledge.
Thank you, Chief. Dan, go ahead.
Yeah, I'm going to say, yeah, we shipped that off to the governor's office directly, and we have not heard a response back. Our Planning and Economic Development Commission is also sending a similar letter in as well. But no, we have not heard any response back to that request.
Thank you, Dan, and thank you, Chief. Let's take our next question.
If I live in the unincorporated portion of the county and I'm disabled and frightened to go out walking in icy conditions, for my second dose in February, do you have people available to travel to our home and administer?
So we are working with the paramedics in the county and with social services and some other groups to identify individuals who might be homebound. And if that is the case, sorry, I was reading a message. And if that is the case, we are looking to provide those in-home services to our most at-risk community members who are homebound. Next question, please.
How do the school opening guidelines affect high school sports teams? Can they practice as a group, basketball, skiing, etc.?
Go ahead, Dr. Boo. Can you field that one for me?
Well, there's separate youth sports guidance that applies to schools, and it'll be based on things what are very strict, only sort of outdoor conditioning and skills exercises that don't require close physical proximity are permitted. There's no competition permitted, certainly no travel. So like everything else, state guidance is subject to change, but that's the current status.
Thank you, Dr. Boo. And Dr. Burrows was asking me to clarify that people, when we send out the link to register for an actual clinic, there are two links in there, one for the first shot and one for the second shot, your booster dose. And we do ask that you register for both at that time. And that'll just help the process go a little smoother when you actually show up. And it's important. Some people have accidentally clicked on the same link twice. So, as you're doing that, just take a second to make sure that you're clicking on the correct link and registering for the proper dose and proper time that you would like. Before we go to our next question, Dr. Burrows, can you give us that update on the hospital and the situation there?
Sure. I'm happy to report that the hospital status is unchanged. I believe at this point we have no COVID patients in the hospital. We are at full capacity as far as our ability to take ICU patients or really hospitalized patients requiring care for any condition. I would like to again clarify for everyone listening that just because we are at full capacity right now, we are a small facility and it does not take very much for us to be full. We have limited resources as far as being able to take care of ICU level of patients. And it would only take a couple of patients, either COVID or trauma related to skiing or whatever activity you're doing or whatever medical condition you're doing, to now put our ICU ability in some jeopardy as far as being able to take on any and all comers. I would emphasize again, that's part of the reason that we are not confident enough to say that our hospital standing alone is grounds to say that Mono County should be free and clear of whatever else is going on around the southern region. Because I think, as everyone knows that's listening, most of our visitors come from the southern region. So in a lot of ways, we are, for better or for worse, linked to them as far as whatever's going on in those areas. And we want to make sure that we are able to continue to care for people. But the decision to open the region for everything has a lot more to do with everything going on and not just what is Mammoth Hospital doing.
Thank you, Dr. Burrows. I appreciate the update. Why don't we go to our next question?
Regarding the sports, Dr. Boo was a bit garbled at the beginning. Could we get a clarification? Sorry.
Sure. Go ahead, Dr. Boo. You did break up a little in the beginning.
Yeah, my Zoom froze and I got dropped for a few moments. I'm surprised you heard anything. So the youth sports guidance is distinct from the school guidance. And the youth sports guidance, what's allowable will be based on tiers. The purple, red, orange, yellow tier system. Right now, certainly in Mono County as part of the southern region, and if we were in a tier, it'd be very, very purple. The only thing that's allowed is outdoor skills and conditioning type drills that don't require close physical proximity. Typical group activities and certainly travel and competition are not permitted at this time.
Thank you,
But,
Dr. Boo. Of course, that's
and of
subject
course-
to change.
Yeah. Thank you, Brian. And there is guidance on the CDPH website. If you go to cdph.ca.gov or just type in California Youth Sports Guidance COVID-19 or something like that, you'll find it.
Thank you, Dr. Boo. Appreciate you answering that question again. Let's go ahead and take our next question.
If one of the recommendations to mitigate the spread is for people to stay home, then why is Mammoth Mountain open?
Let's go to our Chief Freebolt first, and I'm sure other people will have input on this as well.
Thank you, Brian. So the discussion around the ski area opening has really kind of two elements to it. There's certainly a public health component. We've been having a lot of discussion around that. Certainly nothing that's been avoided. And then as with the spring, there's also, the decision that Mammoth Mountain makes from a business perspective. I know those discussions are ongoing. They're detailed and they're complicated. So that's the extent to which I can cover it. And I turn the balance of it to Dan and Dr. Boo.
Go ahead, Dan.
Yeah, I think first and foremost, when the state came out with the guidance under the stay-at-home order, it was very specifically stated that outdoor activities would remain open, and that included ski areas, very specifically noted by the governor himself that skiing, snowboarding, sledding activities, those outdoor level of operations were allowed to stay open under the regional stay-at-home order. So they have that approval from the state to be open. Then, as Chief Freebolt mentioned, the operating guidelines that the mountain's under, we worked with them on those, as well as state guidelines to make sure things are operating safely, especially as you look at distancing and masking requirements and those elements. The other thing the mountain has imposed was it's primarily pass holders only. There is some friends and family, I think day tickets, but they are not actively selling a lot of packages of passes out of different places and stuff like that for day tickets. So they've ratcheted back their level of activity in that perspective. And then under the similar guidelines in the restaurant industry as other restaurants in the community as well. But mainly they're open at this point by their own decision and by specifically being allowed to be open under the regional stay-at-home order.
Thank you, Dan. Dr. Boo, did you have anything you wanted to add to this? Or no, it doesn't look like Dr. Boo does. Okay, we'll go to our next question then.
Is there any resources for construction workers to report unsafe working conditions in terms of COVID guidelines? Is there any oversight for that industry?
From the town's perspective, Rob or Dan, would you like to field that?
Yes, on the town side, if you're out there and there's something that's unsafe, either from a COVID perspective, other safe operations, you can actually get a hold of our building department here or report it in on our code enforcement line. That was up on the last slide in Stu's presentation, I believe. Stu, that information was there. You can report that in or a COVID violation. There's some elements there. And we have gone out, we have met with builders, we have met with them as both a industry group as well as individuals and various projects that have been worked on. We've had follow-ups and there have been some COVID cases in those areas and we followed up there as well. And so if there is an unsafe condition, either from a building standpoint, that's a Cal OSHA issue as well, but we can follow up on the front end. And then if there's a COVID issue, same reporting requirements. And then we do follow up with the job superintendent or the general contractor, or out individually with people on the job site.
All right, thank you, Dan. Go to our next question.
Airbnb was able to cancel all reservations in DC around January 20th. Why aren't they required to cancel reservations in the SoCal region, including Mono County? There are still weekenders coming up and renting condos, etc.
Rob, are you able to field that one?
Yeah, Brian, I can't speak directly to Airbnb specifically canceling those. Our enforcement activities, we recently shifted the essential worker process. If you remember before that, the town was actually receiving all of the requests for essential worker travel and reviewing and approving that in advance of the stays. At the same time, we were also working on enforcement for those folks that weren't following the rules. And we recently shifted some of that responsibility to the operators themselves, requiring them to also submit that to the town with their monthly. But that allowed us to shift our focus a little bit to the enforcement, and that's been very beneficial to our team. So I can't specifically answer the question as to why Airbnb can't cancel all reservations. But I will say that we've got great focus on it, both with the operators as well as in us overseeing the operators to make sure that they're following the rules. So,
thank you, Rob. Much appreciated. Why don't we go ahead to our next question?
Is there monoclonal antibody treatments available for patients in Mono County? That was a mouthful, sorry.
It's a good effort.
Yeah. Is it offered, or does one have to ask for it?
Dr. Burrows, can you address that, please?
It is available. The requirements to receive it are pretty strict. So there are not a lot of people that show up in our emergency facility primarily, or our clinic facility for that matter, that are actually candidates for that. You have to have a pre-existing condition. You have to be well enough that you're not going to be requiring admission to the hospital. You can't have a low oxygen level. And that combination at altitude is extraordinarily difficult to accomplish when you're sick with this illness. For those reasons, it makes it a very limited number of people that can receive it. But yes, we do have it. It is available. If you are a candidate for it, it certainly is a treatment option that you should be offered.
Dr. Burrows, it's also an IV treatment, so there's also that issue of having the capacity to provide that as well, correct?
No, yeah, logistically it's hard to give because you're right, Brian. It's an IV treatment, and then you actually have to stick around for another hour after that to make certain you don't have a reaction to it. So it's pretty involved. Again, limited number of people that are actually going to qualify for it. And then from a logistical standpoint, very difficult to administer.
Thank you, Dr. Burrows. Let's go ahead and take our next question.
We are older retirees over 65. We have a home in Mono County and spend at least 50% of our time there. Can we apply for the vaccine in Mono if we have a home in another county?
So if you are a second homeowner, we do ask that you receive the vaccine in your home community. So basically what's on your license. So if that's LA, then we ask that you actually get your vaccine in LA. Okay, why don't we take the next question?
Thank you. Due to medical issues and previous allergic reactions, it has been recommended I only get the COVID shot at the hospital. How do I register for that?
So that could be a little bit challenging, but go ahead, Dr. Burrows.
I'm sorry, can you repeat the whole question for me one more time?
Sure. Due to medical issues and previous allergic reactions, it has been recommended I only get the COVID shot at the hospital. How do I register for that?
So the idea that you get it only at the hospital is a little tough for me to address because we at the hospital do not have a vaccine supply at this point. We have actually centralized it all through the public health department to try to create a centralized clinic for vaccination. That being said, that clinic is also equipped to be able to handle the conditions that might come up if you have a reaction. And having allergies is not necessarily a contraindication to getting the vaccine. It depends what your allergic reaction is. And off the top of my head, the most specific indication not to receive the vaccine would be you've had a previous reaction to a vaccine made by either Moderna or Pfizer. Conditions such as medication allergies or food allergies or insect bites or things like that are not contraindications, and you are still considered to be a candidate to receive the vaccine. And again, I would emphasize that the clinic situation that you're walking into to get vaccinated is going to be equipped to be able to handle whatever condition may come up. So it's not like you're just walking into the gym, getting your shot and leaving. This is set up to be, in fact, a clinic.
Thank you, Dr. Burrows. And just to add on to that, we do have paramedics on site at every event for just such a situation.
Can someone breastfeeding still receive the vaccine? And if someone has had COVID but a light case, should they get the vaccine?
So not a lot of data on breastfeeding and the vaccine at this point. And, I'll let Dr. Boo elaborate on that. Go ahead, Tom.
Yeah, basically it's considered safe during breast. It hasn't really been studied, but it's not thought that it would be transmitted through breast milk. On the other question, if you've had COVID, you can still get the vaccine. It's still recommended. You would probably have a degree of immunity and protection after natural infection, even a light case, for a period of time. And so the federal recommendations, the manufacturers and the CDC recommendations talk about a 90-day period after an infection, during which our risk of having another infection is particularly low. So it's quite reasonable, if you just had a light case in December, to wait till 3 months have passed before you get the vaccine because it's in short supply. It wouldn't hurt you to get it. There's no safety issues. But you probably wouldn't benefit from it as much as you would if more time had gone by, and there's other people that might benefit, would be likely to benefit more. So
Thank you, Dr. Boo. And I also just want to put out there that we do have people now receiving their second doses, and just a reminder to people that just because you've been vaccinated, that doesn't mean you let your guard down on the other mitigations. You still need to practice hygiene and distancing and wearing masks when in public settings. So I just wanted to get that information out there again and emphasize that. Go ahead, Dr. Burrows.
Yeah, I was just going to, the idea for women that are pregnant or breastfeeding, I think the overall feeling is that getting a COVID infection is still a much more significant risk, either for your unborn baby or for you and your baby once the baby's born. The antibodies that you make as a response to this actually protect the baby both before it's born and then after it's born in the form of breastfeeding. So I think the overall benefit of getting vaccinated is by far greater than not getting vaccinated because of some concern of the risk that you're putting your baby at.
Thank you very much, Dr. Burrows. Let's go ahead and take our next question.
Can I get vaccinated if I'm undocumented? Does Mono County share immigration status with the state?
You can absolutely go ahead, Ingrid.
I was waiting for this question. But talking with Cassandra Montez earlier today, I know that this is a concern for the community. This is protected information, much like anything you would tell your doctor. It does not get shared with anybody. It doesn't get shared with me. It doesn't get shared with Al Davis. It doesn't get shared with the feds. We're not going to report it to ICE. If you owe money on your taxes, we're not going to report you to the IRS. This is completely confidential. We're not sharing that information with anybody. So feel free, please. I want everybody to sign up for the vaccine. If you want to get the vaccine, sign up for it regardless of immigration status. It's not going to go anywhere other than to the providers. They need certain information to make sure that they're giving you the right dosage and that you're in the right tier, but it's not going anywhere else.
Thank you very much, Sheriff Braun. Go ahead to our next question.
Knowing that our levels are some of the worst in the state and knowing California is one of the hardest hit states, why did the health department allow Eastern Sierra Unified School District to open in-person teaching?
Dr. Boo, can you field that?
Yeah, sure. It really wasn't a local decision. There's state rules and guidelines, and the simple fact that Eastern Sierra Unified had opened earlier in the pandemic. I think in late September, when our levels were low enough that they didn't require a waiver or anything at that time, and because they voluntarily closed, the state considers it, what they called a pause, and they're allowed to reopen. Whereas the situation is different for Mammoth Unified because they have not opened during the pandemic. It was unclear to me from the school guidance exactly, where the Eastern Sierra Unified situation would fall in, whether they'd be allowed to open or not. So I emailed some people at the state for guidance, and that was what I was told.
All right. Thank you very much, Dr. Boo. And why don't we take our next question?
I think he said next question. Recently, a local Mammoth family allowed their high school child to host a New Year's Eve party. 20 plus positives have resulted. What can the town do to enforce COVID-19 anti-gatherings, protocols, and restrictions after the fact?
Dan, Rob, and Chief Davis. You're on mute, Chief.
Yeah, I don't think there's any recourse for an after the fact kind of information that comes out later, unless it comes through the county health department that through tracing and people, maybe we can do something then. But that would have to be pretty deeply looked into by the district attorney. Additionally, I just want people to know that okay, we might get reports that there's a party, but we can knock on the door, and if nobody answers the door, we have no recourse to be able to go into the house or do anything. It would take a search warrant or somebody being on probation or something like that. So it's way more involved and in depth than just reporting someone and we can stop them or not. So
Thank you, Chief. Go ahead, Rob.
Yeah, I just wanted to add something to that, Brian. I mean, it's difficult. You hope that this type of information we're sharing on a night like tonight would help parents make a better informed decision with the activities of folks. I mean, it's been really clearly documented that these large gatherings that do occur, we're not going to be naive to that, do cause spreader events. And so I think this type of communication and this type of discussion hopefully is more educational and people sort of start connecting the dots on their own.
Thank you, Rob. Greatly appreciated. Why don't we go ahead and take our next question?
If I miss my appointment to get vaccinated, will I get notified for the next clinic? And also, if I miss my second dose appointment, will I get invited to another clinic?
Yes. The short answer is yes. If you either decline or are unable to come to an appointment, we will catch that in our data process, and you will get another invite to a clinic that you were qualified to go to. All right, why don't we go to the next question?
Have all restaurants been instructed to put tables and chairs away that are outside? There are still several people sitting outside restaurants, and I think this can be fixed with a simple ordinance that restaurants cannot have any tables or chairs outside of their location.
Rob?
I'm actually going to defer to Dan on this one, if he can
Okay.
jump in and answer.
Thank you. Yeah, we have not given the direct order in terms of getting rid of all the tables out there. We've been trying to work with the restaurants to allow some public spaces. A number of cities across the state have looked at options to where if it's not necessarily controlled by the restaurant, or that it's a broader use element, to trying to allow some of that to use. As people do have takeout food, which the restaurants have the right to be selling. The question is, do we want them just sitting in the sidewalk or on steps or in different places that may be more of a problematic concern there to be able to do that? We have been working with a number of them to limit the number of tables and chairs that might be out in a public space, trying to reduce the amount of the areas where they have the direct control over them. You know, they could not ask anybody to leave. If you wanted to sit there for a couple of hours and read a book or soak up some sun or whatever, you would have every right to be there in a public a space to do that. So there hasn't been a direct order at this point for every table and every chair to be removed in those areas. We're working through some recent information we got from the state on some of those areas, and that will continue as we go forward.
Thank you, Dan. Appreciate it. Why don't we go ahead and take our next question?
How many cases of the seasonal flu have been reported in Mono County this year?
2. Yes, 2. Unless something's changed that I don't know about, Dr. Burrows.
No, that's the information I have also. It's been an unbelievably scarce year for flu thus far, knock on wood.
And that was the pattern in the southern hemisphere as well, with everyone, wearing masks, we assume, and distancing. So thank you, Dr. Burrows.
Yeah, just we generally follow the southern hemisphere depending on what their flu season is.
Right.
We can expect that to be the pattern that we follow as well.
Thank you, Dr. Burrows. Let's take our next question.
What is the update on lodging situation in Mammoth? Seeing the tour buses on 395 is disheartening.
Dan?
Yeah, we have limits in place, the travel in place. I have not personally seen tour buses in town in the hotel parking lots and stuff. It doesn't mean they may not be here, but the structure on that is to allow for the critical infrastructure worker only status that's in the stay-at-home order. We do have people filling that out. A number of folks have looked at that and said they don't qualify and have not made the reservations. We put a cap on how much of that type of activity any single rental property can have as well, just so it's not becomes over abusive and or not having everybody allocated just to one particular property. And so there's a ability to share across the various properties in town for that nature. So there is some allowance there. The ability to rent is we've been limiting that at the local level. The stay-at-home order doesn't really require a rental to be closed or to be shut down. What it does, it limits who actually can they rent to. And so we're balancing through that process as well, as we'll get complaints on, well, you can go in other counties, you can get a hotel room in LA, you can go into Inyo County or wherever other places and to be able to rent. And then why not in Mammoth? And so we walk through that same issues in terms of that local control that we put in place to limit the rental activity in town in order to help on our end to enforce the stay-at-home order, but on that as well is just not to have that mixing of people and mixing of individuals at those levels in our community. We can't prevent people from driving in or driving up for a day and back. And if you're coming from out of state, the stay-at-home order allows for out-of-state stays. Individuals coming in are supposed to be in quarantine. I believe it's 10 days before they go out in the community. So if you're coming from out of state and you wanted to be here for 3 weeks, well, the first 10 days you should stay in your unit you're renting. And then the last 10 days or so, then you could be out enjoying the area.
Thank you, Dan. Greatly appreciated. Let's go to our next question.
I received an email from Notify at QuickBase on behalf of Mono County Public Health saying I can register for a clinic. Is this a legit email? What is PrepMod?
That's a great question. I'm glad that this was asked. Yeah, so the email that comes, PrepMod is the software. Basically, it's web-based, but the app we're using to set up our clinics and set up our appointments for those clinics. So that's why you're seeing that on there. The email itself looks a little funny, I gotta say, and it could be perceived as a phishing scam, but it's actually not. It's just a plain text message, and I understand why some people could be concerned that it's not legitimate, but it is. Go ahead, Dr. Boo.
No, I was actually going to turn off my video for a second. I got to go to the kitchen. Sorry.
Okay. Thank you, Dr. Boo. Let's go ahead and take the next question.
I contracted COVID last week. Can I get a vaccination now?
Dr. Burrows, can you field that?
Ideally, you should wait till you are completely resolved from this, and a week is probably too soon. So we know that for the most part, patients with mild conditions after 10 days, as long as they have no symptoms, no fever, are considered to be resolved, and they can return to work and normal activities, going to clinic and whatnot. So that would, to me, be the earliest that you could do it. We already had this question asked earlier in this hour, and right now anyway, I think the best protection you can have is after 90 days. It's not to say you couldn't get it sooner than that. And if you certainly have pre-existing conditions, if you're over the age of 65, I would personally rather see you get vaccinated sooner than later. But if you just were testing positive last week, I would say you're still too early. You need to give yourself a chance to be fully recovered. And certainly if you're otherwise healthy, under the age of 65 and with no pre-existing conditions, it's probably to your benefit to wait until whatever immunity you have is no longer protecting you. And as best we know, that's a 90-day period. And that's, to be fair, probably an educated guess and not anything terribly factual. But that's kind of where we lie with recommending to people when they should get vaccinated. And I think, to be fair, also, you have some relatively natural immunity right now. And the idea that we're trying to vaccinate people that have no immunity is probably what we're striving for. So in order to vaccinate someone that has zero immunity or pre-existing conditions, they're probably going to be more of a priority than you are, because your body's reacting to the virus and making some antibodies that are going to protect you for the next several weeks to couple months anyway.
Thank you very much, Dr. Burrows. We have about just over 5 minutes left, so we can certainly take a few more questions. So let's take another one.
A follow up on the previous question. What if you contract COVID between your first and your second dose? You wait to get your second dose, and then how does that impact the effectiveness of the vaccine?
Dr. Burrows? Dr. Boo?
I'm going to defer, at least in part, to Dr. Boo on this, but generally speaking, if you get sick, we don't like to give you vaccines for any reason. We want you to be recovered. There is certainly some evidence in the United Kingdom, in order to get everyone vaccinated, that they're waiting as much as 12 weeks between shots. So if you were to get your first shot, then get sick, there would still be, I think, a reasonable argument to be made that we would wait for you to fully recover and then give you your second shot.
Thank you, Dr. Burrows. Dr. Boo, would you like to add on to that, please?
I was actually pleased that Dr. Burrows is going to take that one, because that's a tough one. I don't think we've got clear guidance on that, but what Dr. Burrows said makes sense to me. I mean, definitely would probably want to defer it until people were fully recovered, and there's I would probably say wait a month or something like that, and then give the second one. We think that with more time and experience, there will be more latitude in terms of when we can give that second dose. and the things that they're doing in the United Kingdom, as Dr. Burrows alluded to, will help us understand better. The situation now is that these trials were conducted under intense pressure to get protective vaccines to the market in an emergency situation, and it's simply that the vaccine manufacturers in their studies, they only studied these intervals, 3 weeks for Pfizer and 4 weeks for Moderna, that based on preliminary work seem to be appropriate intervals, but nobody studied whether 3 weeks is that much better than 8 weeks or 12 weeks. We just don't know yet, and so we really have to follow the evidence.
Greatly appreciated, doctors.
Your body, I'm sorry, one more thing. Your body's ability to react to a vaccine is pretty good. So you generally, after about a couple of weeks, you're making antibodies towards whatever you're being immunized against. And then your body also has a really good memory. So the idea of the second shot is a reintroduction to your immune system. So your immune system can actually now mount an even bigger response, create more antibodies, and have more longer acting and better protection going forward. And I would agree with Dr. Boo that the idea of the interval between those is, some of that was quite honestly to get people vaccinated and make sure it worked, it was safe, and it was preventing people from getting sick. And I think if there was more time available to say, well, let's do 3 weeks, let's do 6 weeks, let's do 12 weeks, let's do a year, they would have done that. But we're in a pandemic that we're trying to get out of. So I think there was definitely a time crunch to say, all right, 3 weeks, and now we've got people vaccinated, and we feel confident based on what we know about the immune system that they're going to mount as good a response as they're going to after those intervals, and we're going to be able to truly measure how effective our vaccine is.
Thank you, doctors. And let's take our next question.
If someone is in phase 1C due to an underlying medical issue, what paperwork needs to be provided?
So at this point, we're taking your word for it. So, we would ask, we're using the honor system. There's really no way for us to, get your medical records. So, we're just asking that you tell the truth when you fill out that pre-registration. Okay, I think we have time for one more question.
Last question. The incidence of COVID-19 in Mono County is currently among the highest in the world, according to Johns Hopkins and the New York Times. How does the town of Mammoth Lakes thinks its proposed disconnection from Southern California counties is going to help its business? I'm a long-term pass holder, 74 years old. I missed last season, and I'm afraid of coming this year unless the incidence changes.
All right, Dan, you able to address that?
Well, first and foremost, I think if anybody doesn't feel safe in coming up to Mammoth Lakes, and we encourage them stay home. That's the current order we're under. There is a stay-at-home order. The request in terms of looking at what area that we're linked into had to do with a number of factors. One being our demographics, being our location, being our a commonality from our business element, more aligned, frankly, to the Sacramento region with the other ski resorts and mountain communities. And also the reliance on our hospital component. As mentioned earlier, the hospital here in Mammoth Lakes has been fortunate, frankly, to not be significantly impacted by COVID. But also a lot of our hospital relationships go to Northern Nevada versus to Southern California. And so as we look at all of those factors together, there's a question of whether or not we actually align better with a different region that has more similarity in terms of those types of factors. So if those all come into play, we would be under the same types of conditions there. If things change, the Sacramento region was recently taken out of the stay-at-home order. So they're in a purple tier. There still is a fair amount of restrictions on what we can do business-wise there, but it does open up some levels, i.e. outdoor dining, for example. There's also elements still that we would want to maintain, whether we still limit travel components in terms of lodging, whether we always want to continue through this process to remind people to wear a face covering, to practice social distancing, to practice good hygiene, to stay, to the extent possible, not be mixing with other households and that activities. So stay away from those higher risk activities as well. I think the concern from the business community was that linkage into Southern California, the challenges there with the hospital systems, that's not truly accurately reflective of our same medical situations that we're seeing here in Mono County. And Dr. Burrows can speak to their processes with the hospital and how they manage patients. And I think they do an excellent job through that process, be it COVID or be it other types of patients, emergency needs or trauma patients, et cetera. And so the idea was linking in better with what we thought was more reflective of who we are and how our medical system works, as well as the types of economics we have here. We are a tourism-based economy. We don't have the diversity that an LA County has, for example, in terms of the economics or even some of the other surrounding communities that are in the same Southern California region.
Thank you, Dan. Greatly appreciated. Well, looks like we are out of time for this evening. I'd like to thank all the panelists that are here, and I'd like to thank all of you at home that are tuning in. And stay tuned. We'll be back in 2 weeks, right, Stu?
Every fourth.
Every fourth. All right. So until then, take care of yourselves and each other. Good night, Mono County.
Good night.
Everybody.